It is
Good.
9:07 a.m. on October 2nd, 2020, and I'm going to call the Humboldt County Board of Health regular meeting to order. First is a roll call. Dr. Stringham.
I'm here.
Sheriff Allen. Sheriff Allen, are you on? Commissioner Brizenden.
Here.
Commissioner Bell.
I'm here.
Commissioner Cherry.
Here.
Commissioner French.
I'm here.
The county manager's here. Okay. We will go to the Pledge of Allegiance next. If you would all please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all. Public comment. And remember, public comment is we can be addressed by the public on any matter not appearing on the agenda. However, no action may be taken on a matter raised until the matter itself has been specifically included on the agenda as an item upon which action may be taken. You'll need to *6 to unmute yourself if you're on the phone and identify yourself for the record. Do we have any public comment this morning? Once again, public comment period is now. If you have public comment, now is the time. Hearing no public comment, we'll move to item 4. It's an update from the public health officer, local emergency manager, public information officer on the county response to COVID-19 coronavirus. Presentation by Dr. Charles Stringham, public health officer, Captain Sean Wilkin, Humboldt County Sheriff's Office, and local emergency manager, and Nicole Maher, public information officer, regarding the current status of Humboldt County response to the COVID-19 virus, including but not limited to the latest number of positive cases in the county, as well as updates regarding other efforts to mitigate the spread of virus. In addition, the group will update the board regarding the dissemination of information to the public through various methods. We'll go to you first, Dr. Stringham.
Good morning, everybody. Is the sound quality okay?
Yes, it is.
Wonderful. Since our last visit on the 17th of last month, we've had a somewhat of an uptick in the number of cases that we've seen over the last 2 weeks. And I'd like to talk a little bit shortly about some of the specific mechanisms, the hows and whys of why this is happening. But first, before we do that, I'd like to talk a little bit about another extraneous variable that we're going to be dealing with fairly shortly. And I think that's going to cause some difficulties. Want to prepare everybody for it and make sure that that we're able to do the things that we're going to need to do. Much like a lot of different things that happen in life, the complexities will increase as time goes on. And the influenza that's expected here over the next couple of weeks is going to really complicate our COVID response. And essentially, my concern is that we're going to start seeing the coexistence of a syndrome that looks exactly like COVID. And so as a result, the existence or non-existence of symptoms is not really going to help us very much as it has in the past. So this definitely does increase the complexity, but it leads us back to our central defense strategy and the number one thing that we've all been talking about for all these months, and that is the use of all the right techniques, the masking, the social distancing, the hand washing, making sure that people are doing the right things. I kind of thought that even though the messages that we all deliver on this board to the public, they're public messages, and the messages are designed to be disseminated to a large group of individuals so that everybody has to do the right things. But in the end, one of the things that occurred to me is that even though that message is public, and even though the message is distributed to many people, it's absorbed on an individual level by each one of us as individuals. So each one of us make the decision to do the right things. Each one of us make the decision to do these three things that will hold this virus at bay. And so every single day, we're making those decisions on a constant basis. And I would implore each of us to do those right things, to make sure that even when it's not convenient, and even when we're burned out, and even though we have a lot of other things that are going on in our lives these days, to just do those three basic things very consistently and know that you'll enjoy some wonderful benefits. And you'll also be able to bestow those benefits on the people around you. Next, I'd like to talk a little bit about some of the specific trends we're seeing. The FAST team has been hard at work as a result of this spike. We've been looking at a lot of different mechanisms and trying to figure out exactly what this spike is all about, and what the hows and whys are as far as this goes. A couple of different things. I'd like to put this in context for everybody. The first is that the entire state has seen a pretty significant uptick over the last few weeks, and the numbers for Humboldt County pretty much mirror what we're seeing across the entire state of Nevada. But in the United States as a whole, there's been really mixed pictures. And I think one of the things that we're seeing is that school is back in session. And in Humboldt County, I think that's gone very well. We do not think that this uptick is the result of school being back in session. We do not think that. There are a number of other things that I'm thinking are likely going on. And the FAST team's research and some of the background investigations we've been doing on some of the cases have shown actually one thing that's coming up again and again, and that's traveling. There have been a number of different people who've traveled to Mexico, Salt Lake City, and Boise. Those are the three most common destinations. And when they're coming back, in many cases, they're infected. So people are being infected by trips outside of the area. And that actually makes sense because prior to the 17th, when we visited last time, there really hadn't been very many cases in Humboldt County over the weeks prior. And we'd really seen kind of an acquiescence, a quieting of the virus. And it's really reared back up pretty aggressively over the last 2 weeks. So multiple clusters are the result of travel. And I would advise anybody who has travel arrangements for the near future to please be extraordinarily cautious and to realize that when we visit family outside of the area or conduct business outside of the Winnemucca area, it's more likely, because many cases have more cases per capita than we do, that it would be more likely that you'd be infected in outside areas. So exercise extreme caution. Next, I'd like to talk a little bit about the city's wastewater program. And I'm pretty excited about some of the data that we've been able to learn. I think that this is becoming a really formidable tool in our fight against coronavirus. And I'd like to both congratulate and show appreciation for the work that Alicia Heiser is doing. And I'm really impressed by the technique. I'm impressed by the fact that she had really taken the bull by the horns in initiating this program and educating the rest of us about how the program is working and what it can do. And the neat part is that it's doing exactly what she said it would. And it's giving us some lead time and being able to figure out what's going on. So when we visited last on the 17th, it was the case that there'd been no viral samples that had come back in wastewater. So nothing was detectable. And that has changed as of the 15th. That was when a sample was collected. The results were not yet known when we visited on the 17th, but subsequently reported on or about the 23rd of this month. And there was a sample that was taken at the manhole cover located at the intersections of Railroad Street and Baud Street. And there were two samples that were taken. One showed 151 RNA copies per milliliter, and the other showed 128. The two averaged together to approximately 139. And what Alicia was able to learn is that would represent somewhere in the neighborhood of between 1 and 6 infected people in that region, the region that's serviced by that manhole cover. And we realize this is a relatively wide margin, but allowing for differences in habits and differences in slough rates, the amount of viral particles that are shed. The information that we get from this is not exact, but it does let us know that we need to kind of keep our heads up. Alicia had educated us previously that this would show about a 10 to 14 day lead time before viral cases started to increase in a clinically apparent way, because there's a lag that exists between time that we start shedding viral particles in wastewater until the time we're actually diagnosed. And the neat part is that that was exactly what we saw. And we've tried to correlate the number of cases of the 13 cases that we've had in the last 14 days as being in that particular region. And there was one case that was known in that area prior to the 17th when we visited. And there is another single case, so a total of 2 cases that have been known in that area, which is absolutely between the parameters than us. I think this is going to turn out to be a great tool. I think it has the capacity to show a lot of other things. Alicia had indicated recently that there are more positive results, and we're still waiting for specifics on location and quantities of those results. But it's a really good technology, and I think it's helping us out quite a lot. Next, I'd like to bring each of you up to date on some events that have gone on at the school recently. And Dave Jensen, Superintendent of Schools, and I had a chance to talk yesterday, and we've talked to a number of other officials who were involved in the situation that I'm about to discuss. There was at Grass Valley Elementary a single individual who tested positive for the virus. And Dave and I talked very quickly. The FAST team was on the investigation very quickly, and other officials were involved in the case containment. I'm very happy about the way that things went. We have several people who were placed in quarantine. Each of the individuals who potentially were exposed have been interviewed, and the intensity of their exposures, probabilities of becoming positive were assessed, and quarantining was recommended based on criteria that we used. So we feel like we were able to get on top of things very quickly. Of course, you never really know how long a person is infectious prior to becoming positive, all taken into consideration in the FAST team's response. And I'm very pleased about the way things went. I think we responded as quickly as we could have. And I'd also like to point out several other things that, once again, the primary defense strategy, which involves cleaning and involves social distancing, mask wearing, these are all things that were already in place at the Humboldt County School District. And so when we have a person who is infected at the school, we've known that this is a possibility. And because there were a lot of things that were already being done by the Humboldt County School District, I think that we should fare fairly well on this. It's kind of what I'm thinking. Humboldt County School District already has a number of different devices, such as a deep cleaning device and cleaning protocols between classes and with various fomites and other devices that are used. I'm very impressed by the program, and I think it works well. So I'd like to remind everybody that that quarantining people and responding to positive cases is not a primary defense strategy. Those primary defense strategies were already in place before this person became infected. And those primary defense strategies are designed to contain viruses or viral cases once those cases actually occur. So it is expected that we'll have cases, but I think that a lot of the things that the Humboldt County School District, through Dave and other officials, are doing is going to work very well. And I'm hoping very much this will be our opportunity to shine in this case. So I can assure you that the school district is adhering to protocols of each of the things that we've talked about, and I've been very impressed by the things that are going on at the school. I'd like to brief you a little bit more on other FAST team activities. And one is that we've just recently changed the Humboldt County COVID positive response. And so in prior days, up until now, we've used 15 days from the time of a positive test as being or of when a person is able to come out of respiratory isolation, out of quarantine. And because of some new data that we're starting to see, and also realizing that Humboldt County has been very aggressive were particularly long in the periods that we quarantine people for. And the reason is because Humboldt General Hospital really doesn't have a redundancy. There's only one hospital in our community, and we want to make sure that that hospital is protected, that we minimize the number of cases, and that under no circumstances could our medical response team be overwhelmed or compromised based on what should have been taken care of with primary responses. And so we've always been a little bit more aggressive in quarantining and the duration of those quarantines than other municipalities. And but we've decided to reduce from 15 days for quarantining for positive cases down to 12 days. The data supports this, and I've had an opportunity to read some of those most recent articles on the periods of infectivity, and I think that's a safe thing for us to do. It'll reduce by 3 days the time that individuals need to be in quarantine. Remember, this is only for people who are known to be positive. For people who've merely been in contact with somebody who is positive, those people remain at 14 days. So that part has not changed. Just the amount of time for people who are known to be positive. And the other is, I'd like to talk a little bit about testing strategies and testing techniques. Really excited about this. I'd had some nice conversations yesterday with Leanne Cushway, who's the Director of Nursing at Humboldt General Hospital. And I'm really impressed by what Humboldt General was able to do in order to help out with fast team efforts and community response. But essentially, up until now, it's been the case that if a person needed to be tested, COVID tested, that they needed to see a provider at Humboldt General Hospital in the screening clinic, and they needed to tell their story to that person, to that provider, and needed to be able to have that provider agree that testing is necessary. And essentially, this really added a lot of steps. It was kind of arduous for the patients and also for Humboldt General. But as of yesterday, Leanne was able to offer a piece of essentially protocol that allows us as FAST team members to directly refer patients to Humboldt General Hospital, where they can just go in and get tested. Now, this does not mean that people at large in the community are able to do this, but what it means is that when the FAST team feels that testing is necessary, that we can send those patients directly to the hospital where they will be tested. And I appreciate very much the efforts of Humboldt General Hospital, and specifically for Leanne Cushway, Tim Powers, for being able to push this through. Their efforts are very, very appreciated. In terms of other things, some of you may be aware that Golden Valley and Ridley's Pharmacy are also doing testing in the community. And what I had not been aware of is that Ridley's has branched out to do symptomatic testing, and meaning that they're no longer testing non-symptomatic patients only, but they're now testing people who actually have symptoms. I have talked to members of the Ridley's Pharmacy about this, and I'd like to say that it would be my recommendation that if people have symptoms, I would recommend that they call the screening clinic at Humboldt General Hospital and receive directions on what they should do. I think testing non-symptomatic patients at Ridley's Pharmacy and other places is a reasonable idea. We appreciate Ridley's assistance, but I think for those people who actually have symptoms and have a higher probability of being infectious, walking into a retail store and walking to a pharmacy in that retail store is not our community's best interest. And so please, if you have symptoms, call Humboldt General Hospital and receive instructions on what you'll need to do. So in terms of other things, I talked to Tiffany at Humboldt General Hospital. Very pleased that the antibody testing machine that we've been talking about for some time now, it has now arrived. It's very impressive. It was described by Tiffany as being as tall as she is, and is quite a device. Apparently, it's very by this, and it should be up and running within about the next 30 days. There's some verification and testing that need to be done on the device, but it's actually here in the hospital at this time. So brief you a little bit on McDermott cases, and then I'll make some closing comments. Have spoken with Dr. Bay, who's the medical director of McDermott Health Services, and I'm very pleased that McDermott has had only one case recently. So they've really done a great job with case containment. I'm impressed by what's going on there. and did have a chance to meet for quite some time with two investigators from the CDC, Centers for Disease Control and Prevention in Washington, and also very impressed. They were there. They were teaching contact tracing and various techniques that they felt that the local people and providers in McDermott needed to know. And I think that their efforts are very appreciated and likely also played a wonderful role in the reduction in cases. So in terms of closing comments, I'd like to invite everybody to renew our commitments to doing the right things. We realize that people are burned out. We realize that this has been going on for quite some time, but I do see an end in sight, and I'm hoping that everybody will just continue to do the right things so that we can all benefit from those safe actions. Also like to let everybody know that there's been a lot of politicization with respect to vaccinations, and part of this is understandable, but I would encourage everybody to receive their information from non-political sources and kind of leave the cap on the politicized information jar, so to speak. It's important. There's so much great data out there where it comes to vaccinations and the promises that vaccinations will deliver, that we really don't need to be receiving our information in a politicized sense. Here's a little bit about what I can tell you. On a weekly basis, we're receiving good information about some of the medication options, the vaccinations that are in late phases of clinical trials at this time. There are at least half a dozen of them that are showing some really good promise here in the United States and in other places as well. And I'd like to make sure everybody knows that this will end with a vaccination. That's my opinion. And I think that vaccination will be here fairly shortly. That's what I think based on what I've read. And I'd also like to give everybody one final plea. Please, if you're not the type of person who gets flu shots, please make this year the exception. It's critical that everybody have a flu vaccination this year, because remember, we're not going to have a very easy time distinguishing influenza from COVID. And so if a person gets influenza, it's very likely that that will be confused and make it much more difficult to diagnose the more lethal of the two viruses, COVID. So please, everybody, stay safe, get your flu vaccinations, and thank you very much.
Thank you, Dr. Stringham. I appreciate your report. I have a question. On the flu vaccines that are available, I read where there's a stronger dose vaccine for older people. How important is that for the older people to get the stronger dose?
You know, it'd be my recommendation that older people and people with immune compromised conditions, anybody else who has any type of an underlying issue or condition that would make it more likely that if they got the flu, they would get sicker than other people to get that variant of the flu vaccination.
Okay, thank you. Does anyone have any questions from Dr. Stringham?
Hi, can you hear me?
Yes, we can.
This is Patricia Tyndall. I'm calling from the Pleasant Senior Center. I don't know if Dr. Stringham is the person who could answer this question, but I'm hoping so. We know that a lot of people are moving inside with the colder weather. People aren't being outside for bistro eating and that sort of thing. Is there any guidance to follow with upgrading your ventilation system where people might be congregating 6 feet apart, wearing your mask, but more than maybe 10 people in one spot? Is it important to upgrade your ventilation system? And do you have any pointers or information as to what the recommendations are for that?
You know, I can take that. Patricia, it's nice to hear from you. Essentially, your question asks a number of different sub-questions. The first is that when people are sitting indoors, it is absolutely critical to sit further apart than we ordinarily would, and also to understand exactly what your question asks, and that is, when we recirculate air, does that air subsequently cause people to have recirculated air blown down on them and may potentially infect them even if they're sitting greater than 6 feet apart from somebody else? And some of the data that we've seen from aircraft travel and other various systems indicates that the answer to that question seems to be yes, a risk. I think it's a large risk, but there definitely is a risk that recirculating air, especially during cold months when we're not interested in venting that air to outside areas because it becomes less efficient, that filtration is important. So having really good quality HEPA filters and various other filtration systems, I think is critical. But I think the number one most important thing is to be very aware of where air is coming from when you're sitting indoors, and to make sure that you respect distancing to an even greater extent. I mean, I'm always very nervous when I'm sitting directly underneath a vent in a closed building, and I can feel the air coming down on me. So it's critical. If you, especially, you're in a position to be able to change those filters, but in cases where people are not, or if you're in other buildings where you may not have jurisdiction, I would stay away from vents and be in areas where the air may be a little bit less likely to move around. And also, you know, as you've said, with bistros and things of that nature, outdoor dining, if outdoor activities are an option and you can easily do those types of things, I would absolutely minimize risk by being outdoors as much as you can be.
And would adding like air filters or air cleaners or thicker MERV 13 or MERV 15 or whatever, is that like a recommended a thing that we should be doing?
You know, I can't speak because offhand I don't know exactly what the specific recommendations are for things like that, but I can tell you in a general sense that if there are better quality filters that are available to you, I would certainly go with the best quality that you can. And then in addition to that, and potentially even more important, is to advise people to sit outside of areas where air is moving very quickly, especially when it's around other people, ventilated air, that is. Outside, where there's wind, things of that nature, I think it's quite safe. But the critical thing is that even with the best quality air filters, it gives a lower probability of becoming infected. But if I had a choice, I'd rather just sit outside of areas where ventilated air is blowing down on me.
Thank you.
Oh, thank you, Patricia.
Do you have any other questions from Dr. Strangham?
This is Ashley at the Humboldt Sun.
Go ahead, Ashley.
Good morning. My question was just when people are being tested at HDH, if they're symptomatic or if they have known exposure, are they being given a rapid test where they have the results the same day or within a 24-hour period, or is it going to the state level where they have to wait a few days to see the results?
Hi, Ashley. So essentially, Humboldt General Hospital still has a lower supply or lower quantity of the Abbott rapid tests than we'd really like to have. And so the hospital tries hard to not use those tests, except in cases where information needs to be gained and acted upon immediately, where time is of the essence. For other cases, they're still using the nasal PCR tests and sending those into the state of Nevada. And we think, number one, the Abbott rapid tests are quite accurate, and Humboldt General has proven that they're almost as accurate as the nasal PCR, but they're not quite as accurate. That's one of the reasons that Humboldt General prefers to use the conventional nasal PCR test that's sent to the state. But then the second, as I said, is the availability. And so when people go in, as you've asked, either symptomatically or non-symptomatically to Humboldt General Hospital, Humboldt General will preferentially use the conventional nasal swab tests, the ones that you have to wait for a few days for results to come back, and those are the reasons why. That may change in the future when the rapid tests become a little bit more available. I think there will always be the accuracy issue. But when people, for example, go into the hospital for various types of treatments or emergency department visits, those almost always will be rapid tests. And but if a person goes in with symptoms or for an exposure, those in almost all cases will be the conventional waiting tests, the nasal PCR tests.
Okay,
Thank
thank
you.
you. Are there any questions? Any other questions for Dr. Stringham? Thank you, Dr. Stringham.
Thank
We
you.
will move on to Captain Wilkin and your report.
Good morning. So the
Good
newest
morning.
thing from an emergency management perspective we've seen is on October 31st, directive number 33 came out from the state of Nevada. And what that did is it changed the gathering sizes, and I forwarded this out through our COVID group through the community. So now those gathering sizes changed from 50 people up to 250 people, or 50% of the capacity of the gathering location, whichever one is less, so long as the social distancing can be maintained and all the other requirements are met. The goal with that is to keep moving Nevada towards participating in social gatherings, including those facilitated by faith-based communities, and kind of keep us on the path for economic reopening and recovery. Otherwise, emergency management, PPE requests have been consistent. We haven't had any requests that we have had coming in lately. It seems like everybody's doing a good job on the existing supply chains, and we've been in a steady state. We're still getting our reports into the state of Nevada. I just emailed with Justin Luna earlier this week. I also forwarded him a copy of Nicole's last report. I'm trying to get those into the state on a kind of bi-weekly basis, so we're not overwhelming him with it, but it gives him a good picture to keep us off of the county closure criteria. So that's something I'm really focusing on with that, is making sure that we don't end up on that higher risk list again. And by providing him data, that seems to be a good direction that we're going with that. So otherwise, that's the end of my report, unless there's any questions.
Any questions of Captain Wilkin? Any questions? All right, thank you, Captain Wilkin.
Thanks, sir.
Appreciate your report.
You're welcome.
We'll move on to Nicole Maher, Public Information Officer.
Good morning. Can you hear me okay?
Yes, we can, Nicole. Thank you. Good morning.
Great. Well, it's great to be here with you, and thanks for the great information from Dr. Stringham and Captain Wilkin. Over the past 2 weeks, our key messaging themes have asked residents who have attended any large gatherings or who believe they've been potentially exposed to COVID to be tested as soon as possible. And as Dr. Stringham mentioned, we're seeing more opportunities for testing in our community. We've shared that until a vaccine becomes available, testing and contact tracing will continue to be important parts of our community strategy to fight COVID-19. We've encouraged residents to get a flu shot earlier rather than later, especially in light of the pandemic, in order to not overwhelm the medical system with flu issues. The state is asking that all Nevada residents get a flu shot by Nevada Day on October 30th. We have instructed that those who test positive for COVID must continue, as Dr. Stringham said, to isolate for 12 days from the date of testing, and that those who test negative for COVID-19 or who feel healthy still must quarantine for 14 days from the date of testing if they've had an exposure, as symptoms may still appear 2 to 14 days after exposure. We've shared that insurance companies are required to cover with no out-of-pocket cost testing for COVID-19, and that those without insurance can find many free testing opportunities. And we've shared that case increases 2 weeks after major holidays are very predictable, kind of like what we may be seeing because of Labor Day, but they don't have to be. With many major holidays coming up, we can gather, but we should adhere to our tried and true precautionary measures. So in the county, as Dr. Stringham mentioned, things have really calmed down at Fort McDermott. Dr. Bay reports 91 cumulative cases. So as the doctor said, that's up 1 from 2 weeks ago. The majority of those were tested through the clinic. Some were identified through outside clinics. And of course, we had those 8 positives that were identified through the National Guard testing in July. McDermott continues to test. They've conducted 805 tests 89 people have recovered. One person has died, and the reservation currently has one active case. Marcia Foreman at Community Health continues to test asymptomatic people. To date, Marcia has conducted 58 tests, one pending. Golden Valley, 4 of our recent cases were diagnosed through that clinic. They test both symptomatic and asymptomatic. And Ridley's, as the doctor said, is also testing asymptomatic and symptomatic. 2 of our recent cases were tested there. And the good news is, as you may have heard, the annual drive-through flu pod a week ago Wednesday was an amazing success. We drew nearly 1,000 people for the flu vaccination, and Humboldt County School District also had a smaller pod that drew 100 people. And just to add to what Dr. Stringham said to Commissioner Tipton, that flu pod distributed the quadrivalent vaccine, which is much better than the trivalent and one that's recommended for older people. And so we were lucky to get that, and Marcia was instrumental in helping with that. Let's see, on just not necessarily county news, regional news, Nevada National Guard will be doing community testing in Elko every Friday in October, beginning today. And the Guard anticipates testing 200 to 300 people each week, but said they will accommodate as many as come. Hopefully that will be helpful as Elko continues to battle their surge. On our local social media channels, residents have expressed frustration with the mandate to wear masks in local businesses, only to find that store owners and or employees don't wear masks or wear them properly. As one person mentioned, she has been diligent about wearing a mask to help businesses not get fined, but seemed frustrated at her efforts in light of the business's seeming laxness. Local residents are also excited, have expressed a great deal of excitement that Mayor Rich Stone has given the green light for Halloween, while also asking people to put preventative measures in place. And he's been very specific about those measures. And so we will be sharing those and reaffirming what he has said to our community. On the state social media channels, some residents feel relieved at the governor's recent increase in allowed gatherings that Captain Wilkin mentioned from 50 to 250. Others have expressed concern that in the midst of what appears to be an uptick in cases, now is not the time to open Nevada's doors further. Residents are wondering why agencies and municipalities are only reporting COVID statistics, and if flu numbers will also be reported in the same way. Others continue to contest the number of deaths from COVID, claiming that all deaths now, including heart attacks, car accidents, and more, are counted as COVID deaths, which we know is not true. And some on social media are discussing whether the recent surge in Nevada cases could be partly due to President Trump's rally several weeks ago. I wanted to just give you a brief kind of review of our September cases. So now that the month of September has passed, as Dr. Stringham might have mentioned, we had 19 total cases in September, from September 5th to September 30th. And 58% of September's cases were male, while 42% were female. So that was interesting. We usually see the opposite, more female than male. The age breakdowns for the month's cases are as follows. One person in their 70s, one person in their 60s, 3 people in their 50s, 4 people in their 40s, 3 people in their 30s, 4 people in their 20s, 2 teens, and 1 under the age of 10. Now, 14 of the cases were initially identified as under investigation, 3 were identified as being in close contact, and 2 were identified as close contacts. Let me just explain really quickly. And you might already know this, but we've been trying to just help people understand what those designations mean. And so once the FAST team receives confirmation of a COVID-19 case, their first priority, of course, is to isolate that person to mitigate any further spread of the virus. And their second priority is to work with that person directly to confirm any contacts who may need to be quarantined and tested for the virus. But even with a list of contacts, it may not be immediately apparent how that person was infected. So contact tracers initially classify those cases as under investigation until they can the chain that led to the infection. Now, a person may have contracted the virus through an asymptomatic or a pre-symptomatic carrier. That would be a person who's infected but does not show symptoms yet. They could get it from a person who has symptoms but isn't identified as part of their chain, or from some form of gathering where the person may have been exposed to the virus. Now, just in contrast, a close contact, so if one of our reports said that a person was a close contact, that would mean someone very close to the confirmed person, usually a family member. If a case indicates a person had close contact, it simply means they were likely within 6 feet of a person now known to be infected with COVID for a period of time. And so that's how they contracted the virus and were able to trace that. As far as our situation report, as Dr. Stringham mentioned, the numbers are troubling, and Humboldt County is right in the mix. What I'm seeing from these numbers is literally a doubling of what we saw the 2 weeks prior. So here we go. The state just cleared just over 1 million tests performed. That's up 105,000 from 2 weeks ago. That's good news. We are seeing a lot of tests being accomplished. The state has just cleared 1,600 deaths. We're at 1,603. That's up 109 from 2 weeks ago. And let me just mention that as I share these numbers, the good news with all of this is even though the number of coronavirus cases has gone up significantly for most counties, deaths have not. Elko would be maybe just the difference there because of what's happening there. Now in Humboldt, as I mentioned, we're at 130. That's up from 117 2 weeks ago. Washoe. So just to give you an idea, when we met on the 17th, Washoe had gone up 1,700 cases. These past 2 weeks, 3,200 cases. So nearly doubling. They are at 6,400 cases. Deaths, 159. They're up 9, which is on par with what they've been doing about in those previous 2 week periods. Clark, they're just shy of 60,000 cases. When we met on the 17th, they had come up 3,200 cases. These past 2 weeks, 7,600 cases. Again, nearly, or actually more than double. But on the death side, actually much lower. So they're at 1,394 as far as deaths. That's 96 up from 2 weeks ago. But the previous 2 weeks, they were well over 100. Lander stand at 76 cases. That's up from 69, so they've come up 7 cases from 2 weeks ago. Still reporting 1 death, so no change there. Pershing up 1 case, they're at 22, and no deaths, thank goodness. And Elko just kind of tracking the way that they have been. Elko's up 77 cases from 2 weeks ago. They're at 979, and they've had 2 more deaths there, and again, largely tied to the nursing home there, unfortunately. So the big news today is that President Trump and his wife Melania have contracted coronavirus, and there's some interesting thoughts about that. They kind of released those test results early this morning. just after midnight, President Trump's counsel confirmed for the virus yesterday. And so it would be very unusual for him to, within such a short period of time, to be able to show that he tested positive if he only contracted from her. And so there's just some interesting thoughts there about how long he may have been infectious and who he may have infected. And we wish them a speedy recovery along with all others who are suffering with that right now. As Dr. Stringham mentioned, we've received notification of our first positive case through the school district, and impressed, as Dr. Stringham said, with how the district has, and Dr. Stringham, how they've worked to follow their COVID-19 mitigation protocols, and feel very comfortable with how that's going. Captain Wilkin mentioned we've have these new updated statewide baseline mitigation standards as far as gathering. There is extensive guidance available on the Nevada Health Response website, and includes a submission guide for large gathering venues. So these would be gatherings up to 1,000 people. And also, interestingly, guidance and best practices for gatherings at private residences. The governor is asking that we don't do more than 10 inside and 25 on our own property, and as Sean mentioned, guidance for places of worship. The governor also mentioned that he anticipates being able to make additional announcements in the coming days with regard to youth sports, adult recreation, and the upcoming Halloween holiday. So that information will be shared statewide once it's available. The COVID-19 Mitigation and Management Task Force has changed the way they're doing business. So they now release data on Mondays for the following Thursday to say who might be in that hot seat as far as the counties. This particular Thursday, yesterday, they had to postpone the meeting. They had an administrative error on the agenda, and just for the sake of being on the good side of the open meeting law, they went ahead and rescheduled for next Thursday. Interestingly, Washoe County is back on the watch list following a large jump in positive cases, as we mentioned. Speaking of Washoe, they just began phase 2 of their antibody study to see if persons have been exposed or infected with COVID and if they've developed an immune response. Washoe is looking for 290 participants to ensure that the study is scientifically relevant. You might remember that phase 1 of Washoe's antibody study indicated an estimated 2.3%, or approximately just over 8,000 adult infections among Washoe County residents. However, at the time of the first study, only 1,800 adult infections had occurred. So these antibody studies can be interesting as far as the data they can bring forth. The state is working diligently with the CDC to replace the current COVID-19 test with a combination test for the fall and winter months that will test for both flu and COVID-19 at the same time. The state public health labs intend to make this the primary service test throughout Nevada. And I'm sure you've heard this. Interesting. Governor Sisolak says he doesn't plan to take back $8.9 million in coronavirus relief dollars that the state had allocated to Douglas County, even though officials there agreed to allow the Trump rally earlier this month, or last month, excuse me. Governor Sisolak said Nevada provided those relief funds on the condition that the county enforce statewide directives, including limiting public gatherings to 50 people. But the state just didn't want to penalize that county for what they saw as them being in a tough spot. Despite 3/4 of the country's movie theaters reopening, Americans don't seem to be interested in movie night. Some of these recent big studio releases, like Disney's The New Mutants and Mulan and a few others are really limping along. And so that tells us a lot about how Americans are feeling about gathering. It's going to take quite a bit. U.S. government is drafting a plan on how to make the future COVID-19 vaccines free to all Americans. Federal health agencies and the Defense Department have a rough timeline for the vaccine program. As Dr. Stringham mentioned, it's coming soon, hopefully. They're predicting a gradual start in January 2021. And according to an AP poll conducted earlier this year, only about half of Americans said they would get a shot. But we'll see how that changes. As Dr. Stringham said, is we encourage people to get their information from non-politicized sources and to look at good science. Perhaps those statistics will change. So as of Wednesday, this past Wednesday, which is the most recent data I could find, statewide hospital occupancy rates are at 71%. They were 72% 2 weeks ago. ICU units, 58%. That's down from 60% 2 weeks ago. And ventilators in use significantly down, 31% as opposed to 40% 2 weeks ago. So again, we're seeing less deaths, less hospitalizations, and hopefully those are good trends. Division of Industrial Relations continues to monitor businesses across the state for any violation of workplace health and safety measures. 3 Nevada businesses were recently fined for noncompliance, including Stead Food and Liquor in Reno, $2,600 for an employee not wearing a face covering. Gilly Saloon in Las Vegas, $6,000, where the bar top was not closed as required, and customers were actively consuming food and beverages at the bar. And Viva El Taco in Las Vegas, $3,000, where employees were wearing facial coverings below the nose. During the week beginning September 14th, that's the last time they've released information. They conducted 408 initial visits across the state, 88% compliance rate. And guess what? The good news was that Winnemucca had a 100% compliance rate at initial observation. So I thought that was really good news for our community, and we are shining. So beginning September 14th, the United States government removed the requirement that airline flights arriving from certain countries land at one of 15 designated airports. So the government also halted all of the enhanced entry health screening for those passengers. They have found that just has not been effective. Instead, they are dedicating lots of resources to more effective mitigation efforts that focus on individual passengers. And you might remember several weeks ago I mentioned Esmeralda County. Well, guess what? The good news is Esmeralda County, population 974, still remains COVID-free, even after 108 people have been tested for the virus. They are the only holdout in Nevada and one of very few counties in the United States to so far avoid coronavirus. So I think we should keep cheering for them. That's really, really good news. I am happy to take any questions if anybody has any.
Thank you, Nicole. Yes, I have a question. I've seen studies where it relates to death with the number of people with comorbidities, a percentage there. Do they also track normal positive cases as to whether those people that are positive have other health issues?
Dr. Stringham, do you want to take that one?
Nicole, I don't know the answer to that question. I think that I can certainly speak on a theoretical basis, but I'm not sure if in terms of reporting whether there are breakdowns for people with comorbidities versus people who don't have those.
The only, just to add to that, Ken, the only thing that I've seen is just on very specific populations, but not, as far as anything I've seen, and I read a lot over these weeks, you know, like for instance, like a Native American population. Just in general, we know that Native Americans have higher incidence of diabetes, and so sometimes I see some things like that. But I'd be happy to poke around and see if there are some statistical bases that have that information.
Okay, just a question that was rolling around in my head. Does anyone
Sure.
else have a question for Nicole? No questions? Okay, thank you, Nicole.
You bet.
We'll move to item 5. It's an update from Tiffany Love, the Chief Operating Officer at Humboldt General Hospital on COVID-19 and HGH. Tiffany? Are you still with us, Tiffany? I know I saw her on here a little while ago.
You know, Mr. Chair, we may want to maybe get to her earlier because she's probably in another meeting already. And we've lost that opportunity. So, but I can tell you that the antibody testing machine is almost ready. It has arrived on site. It has been put in. They're just doing final testing on it, and I believe they'll be up and running next week, is my understanding.
All right, thank you. Do we have any future agenda items for next meeting? No one has any
Mr. Chair, I
future
don't have
agenda
anything
items?
at this point.
Pardon me? So our next meeting will be at 9 o'clock on October 15th. Okay. Do we have any public comment?
This is Patricia Tyndall again at the Senior Center, and my only public comment is that the flu shot is super important, and Susie Esquivel and Marcia Foreman of our Public Health Department are going to do a drive-through flu shot for any seniors who might have missed the drive-through that we already did for the general public. They're going to do this drive-through flu shot on October 15th here at the Senior Center. People are going to drive through the Port Cochet, and if you are a senior and you haven't gotten your flu shot yet, that'll be October 15th between 8 and 10. And then we're going to do a walk-up for anybody from Larios Arms or Winnemucca Manor, or anybody who missed that drive-through and wants to park their car and walk up to the back door. It will be outside. Please wear a mask and bring your own pen. We have paperwork available so you can pre-fill out any of your forms. And we're just urging anyone who is a senior that needs this flu shot, please come and get your flu shot. So just wanted to let everybody know that they're going to offer that to our seniors, which I think is awesome. And they've been doing a wonderful job getting us vaccinated. So let anybody know if they've missed the drive-through flu pod, they can come on October 15th to the Senior Center.
Okay. If they can't make it on October 15th, can they come at other times?
We won't have Susie and Marcia here, but I'm sure you could call the public health clinic and ask them to give you your shot. And for people that are homebound and on our homebound meals delivery, they are going to those people's homes. So they've been doing a fabulous job. I've just really got to say thank you to Marcia and Susie. If you can make it on the 15th, please come. And if you can't, call the public health clinic and I'm sure they'll be able to get you a vaccination. It's so important this year.
Okay, thank you, Patricia. Is there any other public comment? Remember, if you have public comment, you'll need to unmute yourself. That is *6. Any other public comment? Hearing none. This meeting at 10:07 a.m. Thank you, everyone.
Thank you,
Thank
everyone.
you.